Hi, my name is Dr. Mohammed Nadeem. Today my topic is signs and symptoms of appendicitis. The classic history of anorexia and umbilical pain, followed by nausea, right lower quadrant pain, vomiting occurs in only 50% of cases. Nausea is present in 61 to 92% of patients. Anorexia is present in 74 to 78% of patients. When vomiting occurs, it nearly always follows the onset of pain. Vomiting that precedes pain is suggestive of intestinal obstruction, and the diagnosis of appendicitis should be reconsidered. Constipation and diarrhea is noted in as many as 80% of patients. The most common symptom of appendicitis is abdominal pain. Symptoms begin as periumbilical or epigastric pain, migrating to the right lower quadrant of the abdomen. This pain migration is the most discriminating feature of the patient's history, with a sensitivity and specificity is approximately 80%. Duration of symptoms is less than 80 hours in approximately 80% of adults, but tend to be longer in elderly persons and in those with perforation. In addition, obtain a complete summary of the recent personal history surrounding gastroenterologic, genitourinary, pneumologic conditions, as well as consider gynecologic history. An inflamed appendix near the urinary bladder or ureter can cause irritative, voiding symptoms and hematuria, a pyuria. Cystitis in male patients is rare. In the absence of instrumentation, consider the possibility of an inflamed pelvic appendix in male patients with apparent cystitis. Also consider the possibility of appendicitis in pediatric or adult patients who present with acute urinary retention. The base of appendix was located at the McBurney point in only 4% of patients. In 36% the base was within 3 centimeters of the point. In 28%, it was 3 to 5 centimeters from that point. In 36% of patients, the base of the appendix was more than 5 centimeters from the McBurney point, losing the CT scan. The most specific physical findings in appendicitis are rebound tenderness, pain on percussion, rigidity, guarding, male infants and children occasionally present with an inflamed hemiscrotum due to migration of an inflamed appendix or pass through a patent process vaginalis. This is often initially misdiagnosed as acute testicular torsion. torsion. Excuse me. In addition, perform a rectal examination in any patient with an unclear clinical picture and perform pelvic examination in all women with abdominal pain. The rousing sign is right lower quadrant pain with palpation of the left lower quadrant, suggests peritoneal irritation in the right lower quadrant, precipitated by palpation at a remote location. The obturator The obturator sign is right lower quadrant pain with internal and external rotation of the flexed right hip, suggests that the inflamed appendix is located deep in the right hemipelvis. The Schwarz sign is right lower quadrant pain with extension of the right hip with flexion of the right hip against resistance. We can do by both ways, either by right lower quadrant pain with extension of the right hip or with flexion of the right hip against resistance, suggests that inflamed appendix is located along the course of the right psoas muscle. The Dunphy sign is soft pain in the right lower quadrant, elicited by a voluntary cough, may be helpful helpful in making the clinical diagnosis of localized peritonitis. Medical signs: pain elicited in certain areas of the abdomen when the standing patient drops from standing on toes to the heels with a jarring landing. Thank you.